So we're going to look at inflammation. So this is a revision. So I'll be brief, just focusing on the important things that we need to remember and discuss in case the question comes on inflammation. Definition-wise, we still know that inflammation is a physiological response of the body when the tissues are under damage, under attack, insult, or anything that alters the normal anatomy and physiology of the body. So without complicating matters, we just say inflammation is the body reacting to defend itself in an event that it is under attack, damage, or injury. Even during infection, the body responds via inflammation. But in common use, sometimes we say inflammation focusing on what we see after the process has occurred. We see someone swollen, maybe there's some bleeding coming out, then we say this person was injured and the tissues were inflamed, focusing on the results of the process of inflammation itself. So that is not a correct way of looking at inflammation. So what causes inflammation? Okay, there are so many causes of inflammation. Number one, we have microorganisms. We have physical agents, for example, heat, excessive cold, mechanical injury, ultraviolet light, that is UV light. We also have ionizing radiations. These are radio particles that have the ability to displace genes in our chromosomes. And that way you find that cancers usually arise when you're exposed to high doses of radiation. Worse still, if the radiation is just too much, the heat that comes from there, it can actually cause physical burns on the body. For example, people are near where these nuclear weapons are used. Usually they have nuclear burns. Chemical agents. So we're talking about, chemicals that have the ability to damage body tissues, structures, or organs. Then antigen, we are saying these are foreign microorganisms that have the ability to stimulate the body to produce antibodies. So these are various types of causes of inflammation, or what you can say agents of inflammation. Now we look at types of inflammation. So there are two types, mainly acute and chronic inflammation. Acute, we're saying it's short duration. So we see the whole process of inflammation lasting only for a shorter period of time. The moment the body is aware of this, injuring agent, the body reacts quickly. So there is no delay. So that is the moment the cause is there, the body reacts within the shortest possible time. Then the other one is chronic inflammation, where the body delays to respond to such kind of, agents. Okay, so we have delayed or chronic inflammation. So nevertheless, acute inflammation may turn into chronic inflammation, where the inflammatory process lasts for a longer period of time. Okay, so inflammation has about 4 stages. Okay, once we reach the final stage where the body now goes back to its normal position, the way it was before the injury, the process of inflammation is done or is finished. Now we have instances where this process of inflammation is reoccurring. There's inflammation, the body resolves. With time, again, the body responds. So because the body is kept in that constant on and off, inflammation is on, off, we still classify that as chronic inflammation because the body is in repeated action of defending itself. Okay, so again, acute inflammation can turn into chronic inflammation where the response is sustained over a period of time. So cardinal signs of inflammation. When do you suspect that there's inflammation? So number one is redness. So there's redness on the skin because there's increased blood flow to that area where there is inflammation, where the body is defending itself. And that's where the agent of inflammation is. So number one is redness. What causes it is actually increased blood flow. Number 2 is swelling. What causes swelling is increased vascular permeability. Plasma, some blood cells, antibodies will migrate from the blood vessels into the inflamed tissue, the tissue that is under attack. Next, there's increased temperature in that area which is under attack. So there's heat. Why? Again, because of blood flow. Blood vessels carry blood, and blood is warm. So that's why we all say we are warm-blooded. We're not cold-blooded individuals. So blood, carries heat. Next is pain. Because of the swelling, it compresses on the nerves, so causes pain. Sometimes pain can come from direct tissue damage. Okay, when tissues are damaged, they produce various, substances. For example, prostaglandins. Prostaglandins will stimulate nerve endings. Okay, so those will stimulate painful sensation. Then the swelling itself also causes compression on the nerves. Last but not the least, there is loss of function. Now, loss of function here, we are using this word with, limited use. We're not saying the whole function of that organ tissue is completely lost. No, we are saying there's reduced function in that structure which is under inflammation. Not that there's complete loss. Okay, but these are the cardinal signs of inflammation. When something is inflamed, there's pain. You don't want to be using that part of the body often because it causes pain anyway. So that's what loss of function means in this case. Let's look at stages of inflammation, or phases, if you like. So about 4 or 5 stages actually, 5 stages of inflammation. So number 1 is increased blood flow. All right. So we can break down inflammation in 2 parts. There is cells responding or tissues responding to the damage. The next, we have systemic response. So it's in 2 phases. The tissue that is under attack will respond, or maybe cells, if there are just few cells involved, they will respond. The next is that the whole system of the body will respond. For example, mainly it's a cardiovascular system because we have cells in the blood that are useful in the inflammatory process. So that process of involving cells in blood to go into that affected tissue is what we call systemic phase or reaction. So let's begin with stage 1. Number 1 is increased blood flow. So the moment, actually, this is not correct. So the first stage of inflammation is when there's actual damage. Okay, this damage is coming because of those agents of inflammation we mentioned: microorganisms, physical injury, burns, such kind of things. When that thing occurs, number 1 is that there's damage to cells and tissues. So we need to edit this one. Instead of being 1, this is number 2. The first one is actual damage. When cells are destroyed because of microorganisms, because of acids, because of heat, because of physical injury, the breakdown of cell membranes release prostaglandins. Okay, these are local hormones. When the cell membranes are broken down, these are secreted by the dying cells, and they actually act as local hormones to notify the body that we are in trouble here. So once that occurs, prostaglandins will stimulate nerve endings. So there will be pain, number 1. Number 2 is that because of these secreted prostaglandins, we find that they attract cells from the circulatory system. So apart from prostaglandins, we have things also like histamine and serotonin. Histamine and serotonin. Okay, these are chemicals produced by the dying cells or destroyed cells plus cells of the connective tissue. Mainly, we are talking about mast cells and basophils. They secrete most of these things. When connective tissue in that structure is also destroyed, the dying cells will produce prostaglandins. Then the cells in the connective tissue, fibroblasts, mast cells, will secrete histamine. Collectively, these chemicals, we call them as chemical mediators of inflammation. So if you don't want to explain all those names of the chemicals, just say damage to cells or tissues lead to production of chemical mediators of inflammation. Very well, you'll be marked with all the full points that you deserve. What follows next is step 2, which is now written here, says increased blood flow. So these chemicals, for example, histamine and serotonin. Serotonin acts on the smooth muscles. Okay, histamine also acts on the smooth muscles. So when these chemicals are released, they cause blood vessels to dilate. So this is step 2. After damage to the tissues and release of chemical mediators of inflammation, step 2 is this now, vasodilatation. What is causing vasodilatation is histamine and serotonin. Okay, so in that tissue which is under attack, these chemicals will cause that. So the vessels in that tissue, the capillaries, arterioles, will dilate. What happens when that dilates? There's increased blood flow to that area. Okay, so that is step 2. Step 3, okay, this is just a representation. So normal vasculature here, there's no damage. When there is inflammation or tissue under attack, this is what happens. The blood vessels will dilate, you can see that. And that allows blood to come to this tissue. Okay. So increased blood flow again leads to migration now of plasma from blood into the tissues. Because the blood vessels have dilated, there's a lot of blood there, and that blood will pool or will collect in that area that is under inflammation. So what happens is that plasma will shift from the vessels into that affected tissue. Now, that is the normal process. It occurs even when there's no inflammation. There's a bit of movement of fluid from the blood vessels into the tissues. But in this case now, we want a lot of fluid to go into these tissues so that all the necessary cells together with antibodies can go into that tissue, neutralize the causative agent, and bring about healing. So stage 3 is now movement of plasma from blood vessels into the tissues. What causes that is increased permeability of the capillaries found in that affected tissue. Stage 4 is chemotaxis. Chemotaxis is now attraction of white blood cells. We know that white blood cells are cells involved in immunity. These cells have different types of function. We have different types of leukocytes. We have lymphocytes, we have monocytes, and also have granulocytes and agranulocytes. So we want all those important cells to be in this tissue and neutralize whatever is causing this problem. So that action of attracting those important cells, white blood cells, from the blood into the tissue is what is known as chemotaxis. What causes these chemotaxis again? It's those chemicals that were released early on when the tissues were damaged. For example, prostaglandins. We also have bradykinins. We also have histamines and the likes. So what we call those? We call these chemicals as chemotractants. Chemotractants. They are the ones that attract the white blood cells. And the actual process now of attacking those blood cells is what is known as chemotaxis. So cells now know that there's a problem somewhere in this tissue and they are going to be brought to that tissue by blood vessels. When the white blood cells reach in that tissue that is affected, that is releasing these chemotractants, the white blood cells will attach to those chemotractants and then migrate into that tissue. So that's our next step now, known as diapidesis. Diapidesis is now migration of leukocytes. Remember, leukocytes is white blood cells, different types of them. So the movement of these white blood cells from blood into the tissue is now what is called diapidesis or leukocyte migration. But the attraction of all white blood cells to the tissue is chemotaxis. Now the actual movement from blood vessel into the tissue is diapidesis. So the first type of white blood cell to reach in this affected tissue usually are the neutrophils. Remember that these are the most abundant white blood cells we have in the body. Okay. So that's why if you find neutrophils, for example, you're assessing a wound, okay, then you don't know, is it chronic inflammation? Is it acute inflammation? When you find neutrophils, that's know that you are dealing with an acute type of inflammation, because these only stay there for a short period of time, after which they are removed, they die. But you find other cells, macrophages and the likes, then you're looking at a case of chronic inflammation. So that's how you can understand this. Okay. Later on, we said macrophages now will arrive. So the function of these macrophages as well as neutrophils is the same. They all perform similar function, phagocytosis and neutralization of that causative agent. Again, if there are any dead cells from the body, they will be removed by the very white blood cells, which are phagocytic in nature. Okay. So this is a diagrammatic representation of what we are talking about. So this tissue here is infected with bacteria. See, this is bacteria, then they have vessels in that tissue. So once there's this bacteria in the tissue, the cells of this tissue will produce, various types of chemicals, these ones here. So these chemicals are produced. Okay. Then you find that they were tracked now. These are white blood cells being brought where there's infection. So the cells that are producing these chemicals are the cells found in that tissue and the cells of the connective tissue in that affected area. Mostly mast cells are always there, plus basophils will be found as well. So mediators of inflammation, again, we have prostaglandins, bradykinins, histamines, and serotonin. All those are involved in recruiting white blood cells so that this infection or agent that is causing inflammation is removed. Now, when blood vessels dilate, I forgot this, they don't remain permanently dilated. That's why there's serotonin. Once there's dilatation, white blood cells move from blood into the tissues, the blood vessels will constrict. So they will go back to their original position. Then the last stage of inflammation is resolution. So resolution is stage number 5, where now these cells that initially migrated from blood vessels into the tissue are removed. Okay, so macrophages will destroy all cells that migrated from the blood vessels into the tissues. And if there are any dead cells in that tissue, including the foreign microorganisms, all of it will be destroyed. And then you find that now blood vessels will constrict, fluid that was there will be drained by lymph, and then the swelling is no more. Pain also disappears. All the inflammatory chemical mediators have also been neutralized by the plasma that has gone there. And then tissues go back to normal, and that's what we call resolution. So that's the last stage of inflammation. Okay. And this is where we end. So benefits of inflammation, you can just read through here. Inflammation promotes phagocytosis, promotion of immune response. The body needs to react to whatever is causing problem in it. Then dilution of the toxins by the plasma and the antibodies that are produced. Then increased in body core temperature. So when the temperature goes up, body reaction is also fast. Okay, so that's why most of the time when there's infection, temperature goes up because there's inflammatory process taking place. Then some microorganisms produce toxins that interfere with the thermoregulatory center in the brain. So that's why patients present with fever. Then the harmful ones, when they're swelling, number one, there's limited movement. Then this may interfere with breathing if that swelling occurs in the respiratory system. Then pain, we're saying because of the swelling, it compresses the nerves and causes, pain. Plus, we're saying pus can form. If those dead cells plus the microorganisms are not removed by the macrophages, those things collect there and form pus. So an abscess may form, and later on, that may become a very serious source of autoinfection because those organisms, again, they're not removed from the body. They can enter back in blood and cause septicemia. So I think to be fair, this is where we can end with inflammation.